you, Bob and Dr. Chin. We're so grateful to Paramedic Network and community partners for helping us to share information and important resources from our experts at the Lindner Center of Hope. For those of you who may not be familiar, Lindner Center of Hope is located in Mason, Ohio, and we are privileged to be able to offer a continuum of care for mental health and substance use disorders and other addictions at the Lindner Center of Hope. We treat people from age 2 on up, and the number has no limit. We see people who have very acute needs. So we do have hospital services and residential services. We also have a full outpatient practice, which includes things like our partial hospital program, not only for adults, but for adolescents as well. We also offer intensive outpatient programming, so people are able to do skills building with online features as well. And we also offer a lot of things such as neuromodulation, which can include ECT or TMS. And we're able to do that with the help of 80 experts that we have. They have specialty areas, which include a various number of diagnoses, from depression to anxiety to bipolar disorder to eating disorders, OCD, and other illnesses as well. So again, we're really grateful to have Dr. Cummings on tonight. As her title indicates, she's our Chief of Child and Adolescent Psychiatry at the Lindner Center of Hope. I think, again, it's important to note that we really serve people of all ages and are grateful for the opportunity to help people on their journey to mental health. Thanks, everybody.
Okay, as Jen mentioned, tonight's speaker is Dr. Tracy Cummings. She is the Director of She is the Associate Chief Medical Officer for Clinical Excellence, the Chief of Child and Adolescent Psychiatry, and the Medical Director for Cincinnati Children's Inpatient and Hospitalization Services for the Lindner Center of Hope. Dr. Cummings works to integrate all aspects of physical and mental health into the treatment process. So here tonight, here is Dr. Tracy Cummings.
Thank you for that. I appreciate it. My only correction would be that my medical director role is for the Lindner Center's partial hospitalization program. That would be my only update, but thank you for that enthusiastic welcome. So good evening to everyone on the link tonight. I really appreciate your willingness to choose this educational hour over the likely numerous conflicting tasks, some of them that may be parenting, that also require your attention tonight. And so setting this time aside to gain knowledge is wonderful, and I thank you for that. So our goals for tonight, as we move forward, hopefully, I'm going to really serve as your lead cheerleader for tonight. I want to make sure we're learning about the importance of empowered parenting throughout the lifespan. And by that, we're going to also be discussing ways to implement positive change in your parent-child relationship. One thing I just want to point out for me, that something that stood out through my years of work is when we use the word change, I want you to think about 1 degree of change. So I used to think, oh, something needed to change. It needed to be a drastic, 180-degree change from where a baseline is. But if you think about, an airplane going in a certain direction, if they just have a 1-degree difference in their coordinates, they are not going to land in the same position. So 1 degree makes a big difference. So when you're thinking about working on changes in your relationship, think and recognize and appreciate even the small changes, because those really do add up and make a difference. So I hope that that is a positive thought for you to enter into this conversation with. And full disclosure, there There aren't any major secrets that are going to be revealed tonight that tell you how to make parenting easy. I don't have that, but I do hope that, by the time we finish, you've gained some general knowledge, as were taught when we were younger. Knowledge is power, and so being able to use this knowledge as you move forward throughout whatever stage of parenting you might be involved in. I thought we'd start with just some terminology. It gives us some framework on which we're going to build during our discussion. So looking up empowered, using our friends from the Cambridge Dictionary, they give me this description of being confident and in control of your life. But I really like how they utilize the word of freedom to do something. So it allows us to realize we have some choice here. I think that's really important to keep in mind. And then couple that with our Oxford Dictionary friends. They talk about making someone stronger and more confident. What I would say is to point out here, you'll see the repeat of the words confident and control. In our case, we are not just speaking about ourselves. So if we were just talking about empowering ourselves, then we would have full control over that. But in our case, because we're talking about a relationship, we have to remember we are the only thing that we can control in that relationship. We can't control the other person in that relationship. So I really want you to highlight the confident part of these definitions if you're taking notes, more so than the word controlling. The confidence is what I really want to build up for you tonight. And when we move on to parenting, this search was a little hard for me. I couldn't quite find definitions that I felt were really adequate. So I just had to end up choosing a couple for us to talk about. So keeping with our Cambridge reference, this is really broad and vague to me. The raising of children and all the responsibilities and activities involved in it is pretty nondescript just because it's so broad in its description. And maybe sort of on the flip side to that, this one just from the encyclopedia back when we used those frequently, really for me seems a little bit short-sighted in that it doesn't take into account all the other factors that come into play in the process of child rearing. So I don't love all of these, but it gives us a little bit of a basis of saying parenting's big. It includes a lot of factors. Some are within our control, some are without of our control. And that's sort of the basis. And I would just say that parenting isn't just an action, and even if we back up, parent isn't just a title. It really is an action, but more than an action, it's a process. So it's a process that's really dynamic and it's going to change over time. And the word parent, I think, involves anyone who's involved in raising of a child. So I don't think that that is limited to just the person that provided the genetic material to create life. This is much broader than that. It's whomever is involved in providing, support and resources to a child throughout their lifetime. So that's sort of where we're going to start. So when we talk about parenting being a big deal, it's such a big deal that the U.S. Surgeon General, Dr. Vivek Murthy, had just put out an advisory last month that focused on parents under pressure, talking about really the mental health and the well-being of parents. And in that, he stated, quote, "Raising children is sacred work. It should matter to all of us." And I think that does underscore how big of a job we're talking about here. And so this really advisory talked more about how, this isn't just the byproduct of having a child. It's, real deal work, and it impacts more than just your home. It, in fact, impacts the world. It makes an effect in that big of a way. So that's how important I want you to feel as we're talking. Your role is that important. And though we don't have any hacks to the parenting playbook tonight, I will have some evidence to share with you for why it matters that you keep showing up and you keep putting in the work time and time again, even when it is going to be really hard. So it just a couple of things that I still want to make sure I point out from this advisory, just being it's so important from a parenting perspective. Of the people that were interviewed, 48% of parents say that most of their days that they're feeling completely overwhelmed. And that's compared to 26% of non-parent adults. So we're kind of approaching a double amount of people. So the parenting work is very hard and can be feeling all encompassing. What we know is that parental mental health can really influence the emotional climate, the responsiveness, and the consistency of caregiving at home. So this is super important in this parent-child relationship. And it kind of starts with your, as a parent, mental health and well-being. And what the advisor really calls to action is that we all need to play a role in creating a positive change for this for our country. And that's going to require some cultural shifts. So we really need to respect and value the importance of parenting. We need to have more open dialogue like we're doing tonight. And I really love his statement of where he says it needs to be an all of society approach, meaning we all can take part in this. That's going to include us having funding for programs, paid parental leave, access to whole body care, fostering community supports and really reinforcing that, for a parent to take care of themselves is caring for their family. And so that's very important. And so from the standpoint of a family perspective, I also want us to begin early in this conversation to recognize that all of us partaking in this event tonight, we need to acknowledge that we enter in with our own experiences from our childhood, how we were treated or are treated still by our parents. And sometimes we carry on with us patterns that go back, multiple generations. So we can't ignore the generational impact that can be playing a role in our parenting, and whether that's for better or for worse, no judgment here for that. It's just something we have to acknowledge and then realize we have the choice to be able to chart a different course if that's required for us in our time now. So again, it's that full feeling of feeling confident and making change in that empowerment stance. So as we're going to move through, I really want to highlight some key features that I want us to keep in the forefront of our mind when we're talking about the relationship. So this is in the parent-child relationship, these core features of the foundation. So trust, or think of that in terms of safety, communication, and maybe those are touch points for connection, because it may not always be verbal communication, but being able to connect with one another. And then the division of power. This is a dynamic that is a reality. It is not the same as a friendship relationship or other relationships. It has its own unique set of qualities. So these are things that we're going to keep coming back to as we talk about the different stages when we move through the lifespan here. So obviously we only have time to sort of touch on each of these areas tonight. I want to be able to give some information that stands out in each stage or might be more significant from the parent and child dynamic perspective in that particular stage. Otherwise, I think we could pick each topic and spend the whole time, just on that stage of development. So we're going to go through, pre-birth, infancy to toddler, school age, teenagers, transitional age youth, and then even sort of hit a bit on full adulthood. So no matter which stage you may be in, there are opportunities to build on that foundation, and particularly those 3 areas we're going to focus on tonight. All right, so our first stage when we talk about sort of pre-birth, this is literally building our baseline, right? So foundationally, everything is starting to be created. This is when the brain gets developed in the first place. So that's what's most important in our psychiatric discussion here tonight, where this development begins. So I started off with highlighting the importance here with the impact of genetics plus environment. You may have heard that over time in other ways, like nature versus nurture. You know, what matters most? It's really a combination. And we think about that all the way through in psychiatry. From the genetic standpoint, you know, we are all born with some family history, right? We have predispositions for various things, and that could be, you know, eye color to risk for various health concerns. So that could be a plus or minus from the terms of genetics that you inherit. And then our environment plays a role as well. And at this stage in life, it's literally the home, you know, in utero is the home that's being provided there, and it's the source of life for a child. So at this point, when we talk about that dynamic, the relationship dynamic in terms of division of power, full dependency at this point, obviously. So everything that the person carrying the child takes in is going to be shared with the child. So that includes important things like you have an opportunity to build a good nutritional base that will be shared on. We want to not have as much stress as possible. So when someone is, you know, living in a very stressful state of mind or stressful situations, that increases your cortisol, which again will provide sort of part of the housing for the child within your body. And we also want to not have exposure to substances that could be impairing during this developmental time for the brain that's so very important. So these are some opportunities where you have at the very, very beginning and stages of development. And I highlight this important here about the brain because we have to keep coming back to it as we move through. It's not just once someone is born, now their brain is developed. This is the continuous process. So we could keep having opportunities to impact and strengthen the synapses and the choices that someone may make or the experiences that they have. So, you know, in this case, from the communication part, you know, around 4 or 5 months of gestation, hearing is developed. So there's the opportunity to play music, to speak out loud to a child, read to them. You know, having this begin even before they are born is a nice way to build up that communication and start building a connection. The trust and safety part, that's just the foundation of being able to provide them with a safe space to be growing in and developing in. And so the positive parenting tip I just would want to share from this stage of development is it's important to remember how they explain to you as you're on an airplane. First, you need to put a mask on yourself before you turn to help the person next to you or those around you. If you are unable to care for yourself, it's going to make it very hard for you to be able to help those around you. So this again really reinforces how we want parental mental health to be in the best shape that it can be as they move into this role of parenting. So feel free to don your mask and think of it in that sort of way. I highlight just a really simple picture here to talk about the brain development because this is so important. If you think about the back of the brain, if you will, on here it's labeled the primitive brain, and that is what develops first. It's involved in sort of the real survival basic functions in life, kind of fight or flight, if you will, and some of the things that we don't think about, like breathing and blinking. And then it moves up. So it's kind of, it develops from the back to the front. So it moves up to the midbrain area, and that's going to be important as we talk about attachment here soon and emotional development. And then we think more about the cortical part or the front part of the brain. That's the final part to develop. It's a little bit more higher order function there. It can kind of be labeled the rational brain. It's involved in sort of that thinking, and the prefrontal cortex in particular, so right behind our foreheads, that's involved in really important things like planning and problem solving, and some of the things with our impulse control involved there. That's the very last part of our brain to mature. And so this doesn't happen until about age 25. So remember this as we're talking about very, very young youth. And then even as we've gone into adulthood, there's still maturation happening there. This is why I hope it's really empowering when you think of, oh no, maybe my child's already older than, 2 or 3. There's still opportunities here as we age, because there's still so much maturation happening in young brains and even beyond. But I just want to make sure we highlight that when we move forward. We're going to come back to this topic quite a bit. So then from an infancy, so post-birth to the first few years of life, this is when we're really trying to start building some bonds. That's where I put in here about attachment. As we saw in there in that second stage of sort of the brain development, once that midbrain and limbic area is involved in that. So attachment during this time, what's that really mean? Well, this stage of development, the child really needs a lot of loving attention. They need to feel like there is a safe and secure base for them. And that will go on to impact them in their future. So secure attachments mean they're going to end up having typically better ability to adapt to things. They tend to be more resilient individuals and can regulate themselves a little more easily. So the researcher Bowlby in the past has these attachment theories and talks about how what is created early on is really a lifelong template for relationships. So if someone can feel that they can establish a really secure base, that will allow them to go on to have more secure relationships into adulthood. Even if it struggles early on, it may be harder for them to have trust and have a harder time establishing some of those relationships. A really critical period of time for attachment is around age 2 to 2.5. And they even broaden it out a little bit to like a sensitive period between 2 and 5, where the development of attachment is so important. And it's just your ability to even just show them affection and attention, eye contact, physical touch, those sorts of things. It may not require a lot of your it may not require a lot of your time, but it may require sequential multiple times over time, but it really adds up. It's super important during this stage of development. And I highlight here that separate line of the stage of development because when we think about what someone is expected to learn or achieve as they're growing up, we do kind of think back to what's been listed as stages of development by Erickson many years ago. And in this phase of life, the first one is trust versus mistrust. So we talked about that as being one of our foundational components. So they need to feel like they can build a sense of trust, or do they need to keep having that back part of their brain firing and always being in survival mode because they don't feel safe? Those are things that can build from the very beginning of life. As they get a little bit older, then there starts to be some autonomy, right? They take some steps away from parents. Let me look back and see, are they still there for me? I might walk back and check, yes, my base is still there. So kind of learning, and they're just toying with some of these abilities on their own, which is really important. As they can feel more comfortable with that, then they can move into what's called the initiative versus guilt phase. And this is when they can start showing initiative, like making some decisions It's a good opportunity to start giving children or toddlers, little jobs to do, maybe some chores that can be thrown in, and it starts to allow them to feel like they're playing more of a role in that parental dynamic. Now I have some things that I'm starting to do too. It's not just solely based on the parent. And I did set up the other bullet point here saying expectations. I set that here because I wanted to hit on 2 points. One, communication. At this stage in life, children do not really have the insight to understand a lot of adult nuance or body language, and things. So, and they don't have the words to verbally express all of their needs. So what's that mean? Well, then oftentimes their language may present as very big behaviors because they don't know how to express what all they are feeling. And then the other expectation area I wanted to talk about was attention. When we think about developmental experts, they recommend that if you want to look at an average attention span, take a child's age and add 2 to 3 minutes per year of life. So if we're talking about a 3-year-old child, their attention span may be somewhere between like 6 to 9 minutes. And knowing these kinds of things can help with our expectations for a child. So we probably shouldn't expect them to be able to sit and keep doing one thing for 30 minutes when they're 3 years old because their attention span just isn't that long. So that can save us some frustrations within our relationship to think about these expectations and how they might play out in our real life relationship. So that's kind of it's a helpful thing to know for kids, and it's also helpful for us to be able to tame some of our own thoughts. So where is your role here? You have this opportunity to really be a safe role model. They are sponges right now. So during this critical period of time, there's a lot of changes happening to their brain. They have more synapses than adults. So they're learning and learning so quickly and taking everything in. You really have the opportunity to impact that. They're watching your actions. They're watching how you regulate your emotions, how you speak to each other, and the choices. They're taking all of that in, even if you don't necessarily think that they are. So this is such an opportunity for you to help them experience as much as you can. Whether that's going outside and pointing out when the clouds are moving and just showing how that looks and what's it feel like when we touch the grass, and here's this music, what it sounds like, giving them all of those opportunities for really positive learning experiences with you. And then from the positive parenting tip for this stage, you really want to try to respond to behaviors that you want to see continuing and happening more than you are responding to things you don't want to happen. So there's a ratio that's suggested out there of really 4 to 1. So you want to try to be praising 4 times more than you are punishing or pointing out a negative, if you will. And I'd like to think of this about if you're holding a big bunch of balloons, and when they're full, those are positives. And as we start to pop one every now and then, when there is something that's negative happening, the more positives that you have, it's going to stay afloat, right? It still looks like a nice bouquet of balloons. But if we're doing much more popping than we are inflating, you can imagine that visually, how that can deflate the internal compass for a child compared to building them up. And really, we want to see them build themselves up instead of deflating. I hope that makes sense from that standpoint. Okay, so we will move then on to the school age years. This is an important time of really building independence, and that really plays a role in terms of someone's self-esteem and how they can experience respect for themselves and for those around them. I picked the topic of temperament to really focus on during these years. The American Academy of Pediatrics really describes these factors as playing a role in the development of temperament. And temperament's really like the child's emotional style and how they respond to different situations. A lot of that is innate. It comes to us from birth, but the environment does play a role. And so why didn't we talk about this in the first stage if it's innate? Well, I bring it up here because this is a stage where we start to see our children outside of our home. If in your home you have no other comparison of other children, you don't have other feedback maybe from other adults of how your child is doing, it may be difficult to notice some of these things. But as a child now enters in school, they're around many more other children. There's feedback from teachers that let you know when they're making a comparison to some baselines that they've experienced. And so there's also more bi-directional to components to the relationship once we get to the school age years. You know, you interacting with the child interacting with you. So there's definitely this building of independence, but it's meant to happen along with some really strong connection in the home. So when we think about the temperament part, you know, you may start to think of the particular children in your life and how this applies. But so activity level, this is really referring to movement, whether that's restlessness or being fidgety. Some people are just inherently have more activity than others. Body rhythms is sort of a regularity, like how regular are they with their appetites or with their sleep patterns. In terms of if there's a new thing in front of them, are they someone who's willing to be interested in that new thing, or may they be a little bit more hesitant to that and kind of like things to stay the same? Adaptability. So this would be whenever there's a change that's happening. Some people will really notice struggles when there needs to be a transition from one activity to another. That can be hard and harder for some people than others. Intensity is referring to sort of the positive or negative responses, like how strong that is in either direction. Mood is more how they tend to, their words tend to be and how their behaviors tend to be. And then attention in terms of how distracted they may be or difficulties with concentration. And then the sensory component is thinking about how much stimulus is really needed for a certain child to respond. Some, you know, are very sensitive to sounds or smells or things around them. And then there are others that require a lot in order for them to be impacted. Higher pain threshold, for example. So those can really vary. And so when you're thinking about maybe your particular child, you might need to adapt some of your interactions with them to best suit their temperament. So if they are a child that has high activity level and low attention span, for example, when you're wanting to work together on a task, figure out ways to sit in different spots so they don't have to sit still the whole time. And maybe it's in short increments. This is going to help them be able to succeed a bit easier when it's molded to their temperament. And you can also look at this list yourself, right? So I can see in myself where I fall on some of these ranges. And that can be tricky if my child has a very different temperament than I do, because I'm going to have preferences on how I may want to approach something, and theirs may not be the same. So recognizing the role of temperament can help us really prevent some conflicts as we move forward. And it can also be kind of fun to adjust things to help see that, you know, watch the child succeed when you modify it for them. And if you're a parent of multiple children, you can also sometimes point out how very different, even though they're in the same environment, you know, same parent, for example, but the temperament of the child can still be very different. And so that's something we can work with. It's an opportunity for us to make things better within our home and with our children. Because this is such an important time for their self-esteem, as much as you can in your communication, so that foundation of communication, be really clear and also be really affirming. So positive affirmations during this time go a really long way. You know, you can do it. You know, you are a unique individual. You know, reminding them these sorts of things are really, really important from a parent perspective. And for the safety part, the trust part at this time, the really providing some consistency and predictability is helpful for the school age years. While they're just starting to learn routines, this is something that allows them to build mastery. And when they start to know what to expect, that provides a sense of safety, particularly for young people. So for some of our positive parenting tips at this time, while their language is definitely far more advanced than when we were talking about the toddlers, especially since this age range includes, 4 to 12-year-olds. 12-year-old vocabulary sometimes is really vast, but we still want to give, very clear directions and would make our limited choices for them to have to choose from. That's going to help them set up for success. And I bring up the sleep component because this question comes to me a lot for the different stages of development. At this stage, it's recommended that a child sleep between 9 to 12 hours in a day, right? And so usually by this point, and they're entering school, naps are out of the picture. So we're talking about nighttime at this point, typically. This is something that then will go on to impact the rest of their day. So setting up a really solid sleep schedule can be very helpful as they move through the school years. And I just highlight on here again about the consistency being so important. When we're talking about setting clear rules or expectations, I mean that in a way that because working with young people, I hear a lot of people say like, well, because I was bad, X, Y, or Z happened. Well, what's bad mean? So we need to be much more clear and specific because we don't want someone to take in internally while they're building up their self-esteem that they are bad. There may have been an action that was undesirable or that was problematic for whatever way, but they're not a bad person. And so we want to set some more clear specifics about what we expect. So it might be something like, first do your homework and then you can watch a show. And then establishing the positive and negative consequences that go with that. If you go ahead and do it now, you'll have more time. We could have more time watching a show. If it's not done, we're going to have to miss it tonight. There won't be any show. And then you have to follow through. So this is the consistency part of it. So even when they get upset and angry and don't like that idea, we made that statement of what our expectations were, and we need to be able to hold that. So if then they say only do part of their homework, but protest and you don't want to deal with arguing, which of course makes sense. No one does like the arguing part. And then you allow them to still watch the show. Now we've taught something here. So we've kind of broken what our expectation was and suggested to them that if you even just do part of what I ask, then I'm still going to give you the reward, if you will. And then that can set up for controversy and dilemmas later as they start to get older and compress that a little bit harder. Think about really that positive reinforcement. So the things are like adding on that you want to help contribute to that behavior coming back, whether it's a praise, I'm so excited we get to do this. I hope you feel really proud of it. Wonderful job. It might be high fives. It might be a sticker chart, a present of some sort, whatever you choose to do, that positive reinforcement is super valuable. Sometimes negative, the negative reinforcement can be too, in terms of if you're taking something away, that will encourage them to still do more. Like, so, all right, I'm going to make it to where you don't have to empty the dishwasher tonight because you were so awesome with your sister during dinner. You may choose to do that. And then that's a great way to reinforce how the relationship and the behavior was at dinner. So these are just some things that over time that I feel like are opportunities for parents to really build up the relationship if the communication from the beginning is very clear and the direction is concise and we stick to it. that gives the predictability that lets the child know, this is how it's going to go in my household, depending on what I do to this request. So then we can go on to the tweens or the teenagers. We could easily spend hours just on this stage of development, not just because it's got so many physiological changes happening, but it's also my very favorite stage to work with. So we could do this all night, but we're gonna just touch on a few things in this area with teenagers. And I want to start with calling back that image of the brain development and us talking about how it's going to take really until age 25 to see the full maturation and development there. So in teens, there's the prefrontal cortex, this part, planning, problem solving, decision making, impulse control. This is not formed all of the way. This is still in progress, right? Some cool things about that for teenagers is it really allows them to also take in new information and react to it in real time. So they may get really motivated around, say, like a public service cause that touches them that happened all of a sudden. They can adjust really quickly. They can learn games super fast. They can do languages. It's a really cool thing about their brain and making a lot of changes. The flip side of that is while that part of their brain is not fully mature, the reward center is firing like crazy and is really impacted by things that's like instant gratification and having those rewards. And so that can be tricky when you put those things together, right? So you have this high reward seeking brain, but it is limited in its ability to make good choices and plan and problem solve and think. So as much as their bodies start to look like adults and they may even sound like adults or those getting to that adult age, their brain is not able to do some of the things we want them to do or expect them to do, not because it's their fault. That is just the stage of development that they're in. So I really, really want to highlight that for parents who may be experiencing teenage years because it's such a struggle. They really want to make decisions. However, we also know they still need you to help make those decisions and hold boundaries and keep them safe. This is a necessary thing. So the other important thing during this stage of development, we know that about 50% of mental health diagnoses have their onset by the age of 14. So there will be a lot of changes that happen just being a teenager, and there also will be development of particular mental health concerns that would relate to a diagnosis in some cases. I think it doesn't surprise anyone for me to have up here, this is a time where there's a strong impact from peers that fits appropriately with their stage of development. So during this time, that's the stage called identity versus role confusion. They're really trying to figure out a lot of things, particularly who they are, what's important to them, what are they going to hold to be valuable, and they may try on several different hats until they can find the one that really feels like this suits them best. Which can be frustrating because sometimes you can see them being one way in a certain context and then they may present as another in a very different context. They're still trying to figure it out. They're learning those things. So they need the parental involvement to help navigate all of this for them. There's a lot of change going on once puberty hits and the hormonal component comes into play. Even though they really will start to turn to friends maybe first when they're talking about things or asking about things, if you can stay present and continue to be there and offer to be supportive for them, your opportunity to impact them is still really, really strong. There's research out there that really supports, even if they know of what their parents stance is on particular things, how influential that can be for teens, even if they don't say it to you, and that kind of way. So the boundaries are very important during this period of time. Because there can be impact from these other young folks who are also developing and trying to figure out their identity. So from our trust, our foundational part of trust, they need to continue to know that you're there for them, that you love them unconditionally, and that you will continue to try to be there for them during this time that can be really confusing for a person. On the communication side of our foundation, this can be a little bit trickier, especially when we've talked about the younger folks who don't have the vocabulary or the words to express what they're feeling. You know, at this stage, they do, but they will often try to share things with you or tell you things without using words intentionally. So there may be some things they're doing waiting for you to see or wanting you to notice something about them. So that's very different than our young folks who just don't have the words to be able to do it. There's a little bit more active choice in this stage of development. So as much as you can be there to be an empathic listener, you may be asking them, do they want you to help problem solve, or do they just need to vent? And you can provide an ear for them. That can be very helpful from a relationship standpoint. And try your very best to not compare their current experience to your life experience when you were their age. You know, that oftentimes it doesn't get us very far in those conversations, but it's something that we want to try to hold back and really hear where they're feeling they need the most support at that time. And it may just take you offering up, you know, some way to relate to them. You know, I couldn't tell you anything about Marvel, but I've watched the movies because it's a way to connect with my teenager. You know, there are things that we can try to do to just show like, hey, all right, you're going to beat me at Mario Kart, but I'm going to play because this is my opportunity to have some time with you and have a connection. Because if you're not able to be there, that's when they will fill that in with just other peers or things on people online that they're interacting with more that aren't in their real-time circle of people who are providing support for them. So just, you do still have much opportunity at this time, even when there may feel like there's some pushback about you being an active role in their life. From the positive parenting tip here, I would just say unequivocally, safety is still the role. We must keep our children safe. That trumps all. Even that might mean trumping someone feeling like they don't have privacy. If I'm worried about the safety of my child, I need to be able to intervene and provide that safety. So does that mean I need passwords for phones? It might. Does it mean I need to know who you're going someplace with? Yeah, it might. It may include me taking some safety measures inside my home to help keep you safe. That is something that I would want a parent to keep in the very, very forefront of working with teenagers, because again, there can be a lot of impulsivity, some decision making that can be questionable, and it can really start to get to a situation where they may not be safe and they need you to help them keep them safe. So that's the number one tip for there. When you're working on just interactions with them, try to allow as much collaboration when you can and when it's appropriate. So I really like the concept of powering with instead of powering over. Because if the teenager feels like you are just talking down to them and you are the only one that is making the decisions, or in their case, it leads to defensiveness and it makes it harder for the relationship. But if we want to try to work together on some of these solutions, that tends to have better buy-in and tends to have better outcomes all around. And it's nicer for everyone in the house when that can happen. My guess is if you think about some teenagers in your life, you may not have thought about the 8 to 10 hours of sleep per night, and that includes weekdays while they're going to school. I feel like this is something that maybe comes up the most in terms of a physical symptom at my office is hearing like, oh, they're so tired. Okay, when are you going to bed? And sometimes then that sort of leads to a lot of conversation because oftentimes it's staying up very late and then you have to get up early for school, which then is going to impact how well you can focus during school. What's your mood going to be like during the day? You know, all of those things have a domino effect. So that sleep, again, super important this time. And you may see the flip side, right? Then on the weekend where they can sleep all the way until 2 p.m. sometimes, or, you know, they're catching up. It's because of some of the sleep deprivation that can have happen throughout the week. All right. Boundaries are our friend. So this slide has a little bit of tongue in cheek to it, but I also think it's really important statements that we have to bring up, you know, nonetheless, particularly with teenagers. So what can be frustrating to families if they feel like what they are desiring to happen isn't being fulfilled through the teenagers, sometimes that's, you know, we may not be holding a boundary and teaching them how to hold boundaries. And then we can feel frustrated about that. So that's a work as a parent that gives us an opportunity to avoid that sort of conflict where we can be clear about our boundaries, what we will and will not allow to them to do. Then we don't have to feel that way. I love this one. Stop asking why they keep doing it and start asking why you keep allowing it. I think this can be a really important thing. Again, if the communication isn't solid, there can be problems that persist. And that, I underscore again about the boundaries. There will be pushback from teenagers in particular, and tolerating our children's distress might be one of the hardest tasks that we have to do in parenting. But again, remember we talked about we can only control ourselves. So we can make our statement. We can't control how their emotional response may be. And it's okay to have a boundary and for the child to not love that boundary and might be upset by it. So I like to end that one with reminder that no is a complete sentence. We don't have to continue on in a conflict cycle or discussion. That no is a complete sentence. And so then I want to move to transitional age youth. This might be a label that might not be as familiar to everyone. This is becoming a little bit more talked about. This is really the age range where they're tapping into our teens, but it's late teens, so maybe 15, 16, and then goes to early 20s, that 24 range for a lot of research when you see it. This is thought of as a really unique population of individuals because there's so much that is happening during this period of time, biologically as well as developmentally. There's a lot of role changings for individuals. You know, maybe they're no longer living in the same space as they once were. They may, you know, in some cases, may be a parent themselves as well. So there can be a lot of change while also biologically dealing with puberty and development, brain development, as we talked about, going all the way until 25. So some things that I wanted to highlight for this timeline is some unique circumstances. When we talked about half of mental health diagnoses by age 14 presenting themselves, about 75% will have presented themselves by age 25. So this stage of life is a really important area in the field of psychiatry because this is often the time when we need to start intervening. Now, unfortunately, for a lot of people, they are dealing with symptoms of psychiatric illnesses for many, many years, sometimes well over a decade before they receive treatment. But this is an opportunity for parents because you know your child best. You can see when there are changes that have happened and when you might need to seek additional support because of that. So I highlight this because this is something that's really important because it's very common around this stage of development. TAY, or transitional age youth, that's what that's referring to there, has the highest alcohol and drug use rates amongst all other groups. So these are things to be looking out for in this time. There's high morbidity and mortality, oftentimes from accidents. So usually in this age range, the leading causes of death are accidents, suicides, homicides in this age range. Again, remember, think about this: high reward part of the brain, firing, but the planning, problem solving, rational part is still not fully formed. I think it's interesting to think about the impact of some systems that are in place that can age out for a lot of kids at this period of time, like the foster care system or traditional K through 12 educational systems. For some individuals, that is their source of support and their source of parenting, where they're getting a lot of these lessons taught to them, and then now that ends. And so this can be a really critical period of time where those who may be in their life that has an opportunity to impact their learning can fill in, if you will, on these spots. And I thought it was interesting, for a statistic I found, that about 40% of active military members are actually under the age of 25. So this is, again, a really important population of young people that we want to be paying a lot of attention to, and where parents can play such a big role just because of the unique aspects that they're dealing with. This is a time where we sort of hit that golden 18, where we label people as adults at that point. So they may be chronologically adults, but on some cases they may still be quite dependent upon family. And in other cases, it could be very different. They may have their own home with their own family when they're hitting this stage of life. And so it's really unique for that. But the stage of development at first, like we talked about, after you hit through that sort of identity and role confusion, you move into intimacy and isolation. So relationships become really important, and what your secure attachment maybe allows you to experience or not experience in some of that stage of development. And that even really starts to continue into the full adulthood range. That goes really up until age 40, where those relationships can really be established. And from there, we move on to where someone feels about what they are giving to their job or to their community, sort of that generativity versus stagnation. They want to be giving back and feeling productive in their work, and often that's considered the 40 to 65 range traditionally in the studies. And then over 65, there's sort of the ego integrity and how they feel about looking back over their life and what they have been able to have accomplished over that period of time. And what you can start to see, of course, is in some cases, the role can then start reversing, right? So now the child may be starting to be involved in taking care of the adult when we hit these stages. And so they're kind of doing the parenting, so to speak, in some cases. And I see that as a really hopeful thing, because that's further support for our importance of what we're fostering in children early. This is going to come back around sort of full circle, hopefully, in our relationship as we get older and need maybe their help in terms of our care. And so I just throw out a few special considerations. I think these are a few topics that come up frequently in the treatment setting that I have, working with young people on a day-to-day basis. And I think we can think about where this plays a role with our foundation as well. Some of these things really have a ability to poke holes in our foundation and can stir up some difficulties. The first one there, the screen time, I don't talk about anything more in my clinical practice these days than the use of screen time and electronics or the cell phone. I always think it's very interesting that of all of the things we had to learn in medical school, what someone wants to ask me the most is about, how long can someone be on a screen, or when can they start to use these things? And it becomes such a conflict spot in parent-child relationships. So I wanted to highlight it a little bit. So the American Academy of Child and Adolescent Psychiatry really has some recommendations out there if people are interested, but really no screens for under the age of 18 months, unless maybe there's a video call for a caregiver who's out of town or something like that. And then in our young kids, when we talked about our 2 to 5 year old range, about an hour per day during the week and up to 3 hours on weekends. And then once you get past 6, kind of getting into the school age, they really talk about the importance of setting some healthy habits, not using the electronics at meals, not keeping them in a bedroom, turning them off at least 30 minutes before bedtime. Parents using controls, parental controls and monitoring devices for that on screens. These are things that are all really important. Especially in the teenagers that I work with, the impact of social media can really be a mixed thing, right? So for us tonight, the use of the internet is very helpful, super educational, and that can be the case for some teens as well. Can also serve as an area where they may find people that do welcome them if they aren't necessarily felt like they are included in other arenas. But we also have seen some data that comes out that's concerning for us in terms of its impact on sleep. Some particular concerns of people feeling like they're missing out, so they stay up. Have some cyberbullying that can happen, comparisons made towards others. Unfortunately, poor influence on those that can have body image concerns, so and eating disorders, as well as safety concerns that can happen. And so there are pluses and minuses, and this is where going back to our setting clear expectations and boundaries early is our friend. If we set up rules as a family, here's how we're going to use this, and we all are consistent with that, then there tends to be less explosive arguments about it. But when we allow, say, like full use of it for all times whenever wanted, and then we just pull it away as some sort of punishment, that can lead to very big problems, right? We have better opportunities to work on our communication and our importance with that division of power when we are proactive instead of being reactive. That can also have, the more negative consequences with it. Substance use is another topic I felt deserved some special consideration. According to the Center for Disease Control, young people who have substance use experience higher rates of physical and mental illnesses. They also have diminished overall health and well-being, and of course, the potential to progress to addiction. Because the majority of adults who meet criteria for dependency started using substances during their teen or their young adult years. The hopeful part of this that I want to share from a parent perspective is research has shown, several protective factors for high-risk substance use, and they are, parent and family engagement. It is family support, parental disapproval of substance use, and parental monitoring of a child's behaviors and actions and doings, as well as school connectedness. But 4 out of those 5 all involve the impact of the parent. So again, you have such a vital role and an important role in impacting the future for a young person in your life. And then the last one I put on here is neurodiversity, because this has really come up more and more in more recent years. You may have heard terms like neurodivergence or neurotypical or neuroatypical, neurospicy, even. And this really started as a social justice movement to be an inclusive way to incorporate the differences that may be there and the unique ways a person's brain develops and functions. particularly started for those who may have been diagnosed with a neurodevelopmental disorder like ADHD or autism spectrum disorder or some of the learning disorders that are out there. But it has now kind of grown a bit broader in terms of, but it's really with the mindset of inclusivity and recognizing there isn't like a correct way necessarily to think or process a certain situation or behaviors. We have differences in that. So for those of us as parents who may have a child who processes things differently than maybe our other child, that's helpful for us to know. Again, kind of thinking about temperament, because the way we can intervene for that child or the way we can advocate for that child with their school resources, can vary depending on what their needs are. So I just wanted to highlight that as some things that come up very frequently. And I wanted to sort of end with this. I don't know who to give the proper credit for, actually, but I love this concept as a parent that we really want to encourage you to be a thermostat and not a thermometer.
Mm.
So that means you want to be the constant and be the consistency for a child. So if their emotions go way high, you don't go way high with them like a thermometer. We're going to co-regulate and help teach them ways to bring that back down. And that is something that is just, for me, when I think about best ways to interact with those in our lives, I love this idea of really trying to be a thermostat. It requires work on our part for sure. I don't want to dismiss that, but I love the idea of remembering we want to try to maintain the constant. That's really sort of the essence of what I'd want to convey with this concept here. And so with that, I want to kind of offer up opportunity if there may be some questions that we could address and highlight some of our resources at the Lindner Center of Hope with our Youth and Family Center and services there for young people. And then in particular, our Adolescent PHP program. That's a day program for 12 to 18-year-olds. And it's an opportunity to really work on some of those skills, identifying their particular needs and including family in that, because we just, again, I can't stress it enough that you as a parent have such a vital role. And I just hope that you can walk away tonight from feeling really empowered with that.
Awesome. Awesome, Dr. Cummings. Thank you so much. I do have some questions in the chat. It seems like younger school-age children have to deal with things that used to be that older kids had to deal with, like tweens and teenagers. Has there been a shift in how we parent school-age children with the help of coping with things they shouldn't have to deal with because they're younger?
That's a great point. I do think there has been a shift, even just in my time in the medical field, in terms of what someone may be exposed to at a younger age compared to the past. There's some different theories out there. There's a lot that points sometimes to internet. There are some things that you can see or hear in that world that you cannot unsee or unhear and can really impact our young people in ways that we don't necessarily would have thought could be traumatic, but very much can be. I also think there's some theories out there from an economical standpoint that more households may need to have everyone working in order to financially sustain. So that may mean the young people in the home may have more time where they are on their own, or they may need to also help for things at a younger age to help benefit from the family perspective. Biologically, some things are changing too, whether that's environmental or food intake, some various things like that. Children have, like females can have earlier start of their menstrual period. than once was in the past. So there are multiple things that have changed over time. And it's not just someone's like, am I seeing things here? This is truly happening around us. And so I think we do the best we can, and maybe we shift some of this, like you're saying, you're seeing things that maybe would be in an older stage of development, and the younger, we may have to kind of look at it and bring it into play earlier than we thought we needed to, if that's the case for the particular young person in your life. You're on mute for me. I can't
Yeah, Jim,
hear
you're
you.
muted.
There we go. That question was from Kelsey. This one is from Laura.
Okay.
So what if you have a teen who is wired to stay up later and school starts early? What tip do you have to encourage that teen to get enough sleep?
Yeah, sorry about the lighting that's happening here right now. So this is the case for some individuals. Some people are more, night owls, and some people are early birds. The reality of the circumstance for if someone's in a traditional school setting, we can't change that start time of the school. So a lot of times sleep folks will say you need to look at that time that they need to be up and then work backwards from there. So if, say, school starts at 8, okay, they need to be up so they could start getting ready, have breakfast, do the things they need to do, let's say at 7. I'm just throwing that out there. Then we need to count back from there to figure out where's that sort of 8 to 10 hour range. And if right now they're really far from that time, please don't expect them to immediately just make a shift. It's going to need to be incremental for that to be successful. So maybe you only start with, we're going to try to go to bed about 15 minutes earlier this night. And then we kind of keep working, maybe a half an hour at a time till you can get more to that goal state. For some individuals, they may need some additional help with that. Maybe they need to make sure they're not having caffeine in the afternoon. Make sure there's an opportunity for some movement or stretching that can allow their body to start relaxing. Maybe they incorporate some mindfulness or meditation to relax at bedtime and have a routine of, maybe I take a warm shower. There may be some things that help kind of set the stage, and then very much so limit that use of the electronics right before bed.
Okay. And speaking of electronics before bed, this is more, not really a comment, but a question, not a question, but a comment from Carmen. She does say that not having screens in the room encourages her teen to turn in early, but on weekends, her teen will stay up late reading, and she doesn't go to bed as early as she would like for her teen to. But at least during the week, she is taking the screen out. But this is a question. How do I encourage mothers to interact with their children more?
So maybe this is a person who has contact with young people and family involvement, and they wish there was more interaction, is what I'm taking from that question. Sometimes I like we started the conversation, I think knowledge is really powerful. Maybe they don't know how much of an impact that they can make, and really helping provide them with opportunities to do so. Again, thinking about our generational impact, that may not have been their experience either growing up, so they may not have seen or had someone to model their behavior after that included those positive interactions. And so they may need walked through some of that and supported along the way, depending on their particular circumstance. I often personally wish a lot of the families that I worked with their teenagers felt more confident and their ability to interact with the teen. I think sometimes it gets like, well, it didn't seem like they wanted to talk to me when I asked, what all went on at school. Oh, nothing, and they walked away. I want to encourage them to come at the relationship in other ways and maybe not make it feel like you're doing an interrogation, but, trying to interact in other ways that feel maybe a little more natural. So maybe those are some opportunities. I think it kind of depends on the certain circumstance for that parent and child, but I love that your idea is how do I encourage more, because I'm right with you on that.
Yes. And this is a comment from me. When my son comes home, he's 24. I don't know if this is true or not, because you're the expert. I always worry that my son doesn't have enough interaction with his mother because he's a young man. I don't know that he's all that interested. I know I wasn't all that interested in talking to my mom when I was a young man. I'd rather talk to my dad. So when he comes home, I will purposely not go into the room when he's interacting with his mother. I will stay away so that they have time to interact together. Is that a good thing?
I love that. It's you being intentional of allowing for some relationship bonding to happen, as long as that also means you get your time too. So that way it is shared. And then if
Yeah.
there are opportunities where you can incorporate as a unit, all of you can be together,
Mhm.
that's lovely too. But that you are being very purposeful in that decision is fantastic. Um, because sometimes we are creatures of habit, right? If we are a little bit more comfortable doing one thing, like he is more comfortable maybe talking to you, we're going to do what we're most comfortable doing. But if we that option isn't there, then we may be more inclined to do the other. And so I don't see where that would be a negative of you allowing that relationship to build and you also still have your relationship.
Yeah. Oh, yeah.
Mm-hmm.
Oh, yes. Oh, yeah. I get my time. All the time.
Good. Good.
Didn't take too much of it. Any other questions? These are really, really good questions. Great presentation, Dr. Cummings. Just love it. Really, really good stuff. Anything else out there? Okay. Well, Jen, I'll throw it back to you. I'll let you close out, and we really thank you. Really thank you for this partnership with the Paramedic Network. Thank you so much, Dr. Cummings. Thank you, Jen.
Yes.
Thank you.
Thank you, Bob and Jim. Appreciate you hosting us this evening. Thank you, Dr. Cummings, for your wonderful presentation. And thank you for everyone who was able to join us. Really appreciate the time that you took to listen in and participate. So we really appreciate that. We do post a recording of these sessions on our website under the resources tab. So those will post hopefully by next week. So if you missed something or want to go back and listen again or let a friend know about it, we certainly would appreciate that. Thanks so much. Take care.